Boy, all too often, local law enforcement respond to 911 calls of local teens taking their own lives. 1 in 5 middle school students in our city here in Jacksonville say they have seriously thought about suicide. And here's another startling number for you. They're twice as likely to attempt suicide as other students around the state of Florida. And that's according to a 2009 Youth Risk Behavior Survey conducted by Duval County Public Schools. Jim Clark, the president and CEO of Daniel and a licensed social worker, is here this morning to talk about some of the programs Daniel is offering to try and prevent kid suicide, really, teen suicide.
Right.
And talking about. It's an alarming number here in Jacksonville for whatever reason, and I'm sure there's studies being done to figure out why, but we have a higher number here than the national average.
We do. We almost have double the rate, and in particularly for middle school youth, it is 1 to 10 actually making an attempt. And there's a high-risk population, too, that the communities need to be aware of, and those are often youngsters who are high achievers, believe it or not, who the stress of their academics may get to them or whatever those situations are, and those children who are bullied are often youth who engage in or attempt to try to take their lives.
Here's another scary number. We said 1 in 5 middle school students have thought about suicide. 1 in 7 high school students have seriously considered suicide, and 1 in 10 have attempted suicide.
That's
that's incredible when you think about that.
It absolutely is.
That's here in Duval County.
That's here in Duval County, and that's one of the reasons that we were able to receive a federal grant through the University of South Florida to help address this issue. And Daniel has a program. It's called Adolescent Suicide Prevention Project. It's a pilot project in which we attempt to educate the community and individuals who are working with youth to ages 10 to 24 on some of the signs, some of the risk factors that are out there. And typically there are 14 signs, but we've identified 4 that we think for the viewers are really important for them to be aware of.
Okay.
One is aggressiveness and irritability. Often, you know, it's really difficult to tell, is this just a teen going through the changes, or is this something else? But
I was going to say all teens pretty much go through that.
That's right.
At some point.
But change and sudden behavior is certainly something. Engagement in risky behaviors. We tend to be, as teens, you're daredevils anyway. But if you start to engage, I don't care about if I die, or those kind of comments, indeed, that suggests something. The telltale sign is kids are giving their things away, particularly cherished items, or they're giving their items to their siblings who they've always wanted, but they're not going to get it back. It's pretty evident. So those are also signs. And I think another important sign that people really need to be aware of course, is kids who do dark talk. They start to talk about harming themselves, or they talk about, what do you think it would be like if I was dead? Those are signs in which people can say, it might be an adolescent just going through some changes, but they are things important enough for us to pay attention to.
What can a parent do at that point if they see one of those red flags? What do they do? They just talk?
Absolutely. Number one thing we've always say is talk about it. Number 2 is don't be afraid. Talking about suicide does not cause suicide. There's lots of myths about it. If I talk about this,
it's a taboo. Yeah,
if I start, this is going to make them thinking about it. That's not true at all. Make sure that you do talk about it. Be open. Listen. And if indeed you have some concerns, involve a counselor. And I tell parents, and we've unfortunately had to do this, if you really are fearful and we can't get there in time enough, then call 911. Police officers are taught in terms of how to intervene, and in fact the Sheriff's Division has been doing a lot of things with mental health, and their officers are trained with that. 911 would be the last call.
You're offering 2 interactive workshops. This is good. Daniel's administrative office is at 4203 South Point Boulevard on June 30th. There's one from 9 in the morning until 10, and one from 6 in the evening until 7. So they're only 1-hour sessions.
That's right.
Be pretty quick, but they can answer your questions. For more information, to register for the seminars, also you can call Daniel Kids. The number's 296-1055 extension 2319, or you can visit the website danielkids.org. All right, thank you, Jim. Appreciate it so much.
Thank you, Jay.
Next hour.